Hello everyone, it's Crystal again. Um, I would like to say hello to everyone, and I hope everyone is enjoying their internship. I hope everyone is actually learning and getting that social work experience. I would like to say, I would like to remind you again that I'm at Legacy Hospice of the South, and it's a hospice with mainly terminally ill individuals with a life expectancy of 6 months or less, unless otherwise the terminal illness, the patient is still decreasing or declining during the expected course of the terminal illness. This week, the last 2 weeks been pretty laid back. I've caught up on some things. Worked with my field instructor on a couple of things, and again, we always review safety. Um, I don't know if I mentioned in my last videos, but every other Thursday, which was not tomorrow, but last Thursday, we have IDT meetings. And during this meeting, the staff of the agency, which are RNs, a chaplain, the social worker, or the bereavement coordinator, you have a medical director, and a patient care coordinator. They all get together along with the doctors that their agency is associated with. They get with them and they discuss each patient one by one. The nurse is responsible for keeping the agency or that particular office updated on the clients and what's going on with the clients and their families. Um, the social worker doesn't, we attend, but we don't have much to say during these meetings unless we see some type of psychosocial issue or with the patient or with the family. So during this meeting, we kind of give an update on mood behavior, funeral arrangements, if there are any difference or anything changed. If the how well the family is coping. If we find that the family is kind of decreasing in coping, we work with them and we inform everyone in the meeting of what's going on, and we determine how can we help them. Once we see a decline or a decrease in any clinical issues such as behavior, mood, or just the family coping, we have to create a care plan, and that care plan has to be between the patient, the family, and the agency, which in this case will be the social worker. How do we plan to help the patient, or how do we plan to help the client or the family? Sometimes we have several patients that are older adults, and they're at the point where they're sleeping more. Well, we understand and we try to get the family to prepare. So if that particular patient is sleeping too much, which we had one, she's beginning to sleep a whole lot more than she usually do, and if she's sleeping, that means she's not eating, and she misses most of her meals because she's sleeping. Well, in that case, the family is getting worried. What's going, what might be happening or where the illness may be going. We just kind of stand by their side and kind of help them and remind them that we're here for you. We are here for you because the agency believes in giving these patients the best quality in life, especially when they have a life expectancy of 6 months or less. So that's kind of this week. I did a lot of what they call tuck-ins, and what that is, we call each family. Um, the families that are at the home, that are in homes, we have some. Most of our patients are at home, and we have some that are in nursing homes. But the ones that are at home, what we mainly do is we kind of like call them and remind the family that we're here. And what we do is we do it in the middle of the week, because by the end of the week, we want to make sure that that family or that patient has everything that they need, and that includes if they need any social work help, if they need any supplies, if they need any kind of attention from the agency. We just call and kind of check on them and see if they need anything. And it's kind of a reminder of we haven't forgot you. Even though we see each patient as social workers, we see them once a month. But as nurses and CNAs, they see them almost every day or every other day, at least 3 times a week. So what I did was I called the family and kind of talked with them and remind them that we're here and to see if there's anything they need. And my job was to, after speaking with them, go back to the nurses and let the nurses know, this is what this particular patient needs by the end of the week in order for them to have everything they need. Also, I deal with concerns. If the patient have any concerns, that goes through the social worker, because they want each patient to get the best service, especially at this point in their life. So this week was kind of relaxing, but we still had patients to take care of, care plans and everything. We worked on this week. But I'm glad to hear everybody's doing well. And we've made it, almost halfway through one course. So I think we're all doing good. And I just want to encourage everyone to please stay on board. It is stressful, and we do get burned out. Just remember your self-care. And I wish everyone the best.